Hi guys, how are you doing? A trauma happens when we are victim or when we witness a event or a situation of high violence or a situation that is shocking to our conscious mind, and our body as a total cannot process it adequately. So our subconscious mind will absorb it because our subconscious mind absorbs illogical events while the conscious mind shuts down because it's very logical. So that's why a trauma is not processed adequately, because the conscious mind, to protect our sanity, will shut down and will, send to the subconscious mind that such a violent event that is so difficult to be processed rapidly. Because remember, a trauma happens very rapidly. In our body, because also of the nature of the trauma, that usually, of course, is very negative or is difficult for us to really understand that situation when it happens so fast and so violently. Our body will not be so present, our sensations will not be so present consciously. What happens is that the amygdala and the limbic system, which is the system of emotions, will be hyperly activated to put us in the mode fight, flight, or freeze, hyperarousal or hypoarousal. Fight, flight, and freeze, hyperarousal, alarmed, vigilant, and hypoarousal, which is the freeze and dissociating or avoidant of the situation, is when we are in state of shock and we cannot move. So because the trauma is so violent, is such a violent element to the body, our body still absorbs it, but not in a logical way or effective way. That's why a trauma is formed. And a trauma happens in every level that your body has. It's not only cognitively, it happens cognitively, emotionally, sensation-wise, visually, even the five senses, they can be very present. Let's say that you are traumatized, by 9/11, for example, and what you saw, those buildings, all dropping, in some minutes, it was so traumatic, and there was like a smell of burning in the air or smoke in the air. So that when you will, after some months, you will smell that smoke again, and you are in a completely different situation, your mind will remind you of that shocking, image, and you might have flashbacks. That's what it is called, flashbacks. It is in a flash of some event that happened, in the past. So it's important to understand that flashbacks, they are not bad things. I tell clients that flashbacks and even triggers are elements that the body is giving you just to help us to understand that there is a puzzle there that is missing pieces. So therefore, it's so important to look for a therapist that is specialized in trauma, that can help you to put together all these puzzles of all these puzzle pieces of the trauma along with you. A trauma to be healed, we need to have consciousness about, the trauma, and for us to make the, volunteer choice to go into work, with the trauma is very scary, because we don't want to go to the same place. We don't want to feel the same pain that we felt when we were being traumatized. So it's important that we work in the trauma slowly. Remember, the trauma happened very rapidly, so the healing of trauma, it needs to be done with patience, very slow and very conscious. Okay, I will give you some names of some interventions that they are good for trauma. There are many, but I will give you some, and of course you can search for the ones that works better for you. One calls EMDR, is an eye movement desensitization reprocessing. It is a trauma intervention. Also works with anxiety, depression, eating disorder. Is very, complete. EMDR will help you to reprocess thoughts. Will bring your attention to either in an image or a sensation of the body or an emotion, and will, along with building your focus on the present moment, and the eye movement that the therapist or somebody that is training EMDR will be, you will be following the fingers of the therapist, and it's said that little by little, because of this bilateral movement, your prefrontal will have more focus on what needs to be focused on, and also the image will little by little disappear, because our conscious mind is present now, and our conscious mind can't take stress. So the conscious mind will find a way to build sense about that situation. Okay, so it's a very interesting therapy. Is minimal 6 sessions, maximum 20 sessions of EMDR. Some clients, they don't even need more than 6 sessions. Okay, another one that I would recommend is a EFT, emotion freedom technique. Is a tapping intervention. You're going to be tapping some meridian points that we call of emotional blockages in your face while you talk about whatever is bothering you. And it says that when you are doing this tapping in these meridian points, you are opening emotional blockages, and you are allowing the body to distribute that tension that in some parts of your physical body will be retaining emotions. Okay, so of course CBT is also a very good intervention for trauma, in DBT, which is an intervention that will help you to regulate your emotions, to build tolerance with distressful situations too. Okay, and also will help you with mindfulness, which is building the focus to the present moment, in the present moment, while you are dealing with images that you dislike. So it's a very also interesting intervention. Okay, trauma focused therapy, biofeedback. So these are some interventions that I'm going to give you today. There are many. That's very good, because there are many interventions. But I'm going to stop the video here. I hope that some of the content can help some of you, and you guys have a great day, have a great week, and I will talk to you soon. Have a great day. Bye bye.